Question 21. A 26-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? A. Sexual dysfunction related to radiation therapy. B. Anticipatory grieving related to terminal illness. C. Tissue integrity related to prolonged bed rest. D. Fatigue related to chemotherapy. Answer A is correct. Radiation therapy often causes sterility in male clients and would be of primary importance to this client. The psychosocial needs of the client are important to address in light of the age and life choices. Hodgkin's disease, however, has a good prognosis when diagnosed early. Answers B, C, and D are incorrect because they are of lesser priority. Question 22. A client has autoimmune thrombocytopenic purpura. To determine the client's response to treatment, the nurse would monitor A. Platelet count. B. White blood cell count. C. Potassium levels. D. Partial prothrombin time, PTT. Answer A is correct. Clients with autoimmune thrombocytopenic purpura, ATP, have low platelet counts, making answer the correct answer. White cell counts, potassium levels, and PTT are not affected in ADP, thus, answers B, C, and D are incorrect. Question 23. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura, ATP. The client's platelet count currently is 80,000. It will be most important to teach the client and family about A. Bleeding precautions. B. Prevention of falls. C. Oxygen therapy. D. Conservation of energy. Answer A is correct. The normal platelet count is 120,000 to 400,000. Bleeding occurs in clients with low platelets. The priority is to prevent and minimize bleeding. Oxygenation in answer C is important, but platelets do not carry oxygen. Answers B and D are of lesser priority and are incorrect in this instance. Question 24. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? A. Place the client in Trendelenburg position for postural drainage. B. Encourage coughing and deep breathing every 2 hours. C. Elevate the head of the bed 30 degrees. D. Encourage the Valsalva maneuver for bowel movements. Answer C is correct. A prolactinoma is a type of pituitary tumor. Elevating the head of the bed 30 degrees avoids pressure on the sella turcica and helps to prevent headaches. Answers A, B, and D are incorrect because Trendelenburg, Valsalva maneuver, and coughing all increase the intracranial pressure. Question 25. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is A. Measure the urinary output. B. Check the vital signs. C. Encourage increased fluid intake. D. Weigh the client. Answer B is correct. The large amount of fluid loss can cause fluid and electrolyte imbalance that should be corrected. The loss of electrolytes would be reflected in the vital signs. Measuring the urinary output is important, but the stem already says that the client has polyuria, so answer A is incorrect. Encouraging fluid intake will not correct the problem, making answer C incorrect. Answer D is incorrect because weighing the client is not necessary at this time. Question 26. A client with hemophilia has a nosebleed. Which nursing action is most appropriate to control the bleeding? A. Place the client in a sitting position. B. Administer acetaminophen, Tylenol. C. Pinch the soft lower part of the nose. D. Apply ice packs to the forehead. Answer C is correct. C is correct because direct pressure to the nose stops the bleeding. Answers A, B, and D are incorrect because they do not stop bleeding. Question 27. A client has had a unilateral adrenalectomy to remove a tumor. The most important measurement in the immediate post-operative period for the nurse to take is A. The blood pressure. B. The temperature. C. The urinary output. D. The specific gravity of the urine. Answer A is correct. Blood pressure is the best indicator of cardiovascular collapse in the client who has had an adrenal gland removed. The remaining gland might have been suppressed due to the tumor activity. Temperature would be an indicator of infection, decreased output would be a clinical manifestation but would take longer to occur than blood pressure changes, and specific gravity changes occur with other disorders. Therefore, answers B, C, and D are incorrect. Question 28. A client with Addison's disease has been admitted with a history of nausea and vomiting for the past 3 days. The client is receiving 4 glucocorticoids, Solu-Medrol. Which of the following interventions would the nurse implement? A. Glucometer readings as ordered. B. Intake/output measurements. C. Evaluating the sodium and potassium levels. D. Daily weights. Answer A is correct. For glucocorticoids raise the glucose levels and often require coverage with insulin. Answer B is not necessary at this time. Sodium and potassium levels would be monitored when the client is receiving mineral corticoids, and daily weights is unnecessary. Therefore, answers B, C, and D are incorrect. Question 29. A client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? A. Obtain a crash cart. B. Check the calcium level. C. Assess the dressing for drainage. D. Assess the blood pressure for hypertension. Answer B is correct. The parathyroid glands are responsible for calcium production and can be damaged during a thyroidectomy. The tingling can be due to low calcium levels. The crash cart would be needed in respiratory distress, but would not be the next action to take, thus, answer A is incorrect. Hypertension occurs in thyroid storm and the drainage would occur in hemorrhage, so answers C and D are incorrect. Question 30. A 32-year-old mother of 3 is brought to the clinic. Her pulse is 52, there is a weight gain of 30 pounds in 4 months, and the client is wearing 2 sweaters. The client is diagnosed with hypothyroidism. Which of the following nursing diagnoses is of highest priority? A. Impaired physical mobility related to decreased endurance. B. A hypothermia or/T decreased metabolic rate. C. Disturbed thought processes or/T interstitial edema. D. Decreased cardiac output or/T bradycardia. Answer D is correct. The decrease in pulse can affect the cardiac output and lead to shock, which would take precedence over the other choices. Therefore, answers A, B, and C are incorrect.